Good afternoon, everyone. Welcome again to Marketing Moments webinar series. Can't believe we're still doing this. My name is Julio Barea, Vice President of Sales for CareTime. And as always, I'm joined by my friend and partner, Debbie Miller, CEO of 52 Weeks Marketing and founder of Senior Helpers in Nashville. Good morning, Debbie. How are you?
Good morning. Fantastic.
You know,
Well,
I
I
think,
a little bit of
please,
technology problem there, but whew, we're good.
we made it down to the last 30 seconds of no audio just before the call, but I think we did good on that one. We appreciate everyone joining today. I believe this is our 18th webinar, Debbie, that we have done in the last year and a half. And we
Amazing.
are also very excited to those that have joined us today and that have registered because we believe you may be our largest audience so far. So give yourselves a hand at home or in the office or wherever you are. Thank you for being part of this. We're excited to have it. I know, right? We'll be in a million in a couple of years, and then we'll be on Spotify and compete against Rogan and call me daddy. So
Nice.
all right, so we're going to talk today about something really interesting. I know I always say I'm super excited. This one's interesting to me. Debbie, you spent a lot of time on this.
I
Um, I
do.
can I
I
can
do.
tell, and this particular part of what you teach on these calls about making referrals your superpower is really more of a deep dive from something you spoke about last year, right?
Yes, we're going to delve into some data. And I'm really excited to share. This is the first time that we're sharing the specifics here that we've been able to call from the 52-week CRM, which is a home care specific CRM that is beyond your normal CRM because it's really tracking marketer activity. And what we've been able to do is slice and dice the data. And for today, I've kind of sliced it into and given us an opportunity to look at a broad spectrum of results across three key segments. So the low producers, what I mean by producer is referral producers, so companies that have marketers out there. So the low producer, average, and high producers. And so it's going to help us better understand what is really working, what isn't. And it's confirmed a lot of what I've always believed to be true, but now we've got some data to really back this in our methodology, but also some really exciting learnings that I'm going to be able to share today. So really looking forward to it.
Yeah, when I was going through these slides with you before the show, there's just some stuff on here that, as somebody who does relationships and build those for a living, I was really amazed at what I'm seeing. So before we jump into it, let's talk a little bit about where we're going to be next. I would love if every one of you who registered here and is here today, please come see us again on August 20th at 12 p.m., where Debbie's going to share her thoughts on creating specialty care programs like dementia care that are really going to help you differentiate yourself in the community. Because if there's one thing that we've learned, whether it's Debbie's business or it's my business, is you have to separate yourself from the rest. And how do you do that? And so I'm going to say the words. I'm excited to see what that was about. I can't not get that word out of my vocabulary, Debbie, but it happens every time we're on a call. So we're going to talk about that. Today, Debbie's going to cover the power of personal touch, how to establish meaningful relationships with doctors, discharge planners, care managers. In other words, how to become their go-to, which is a different conversation than talking to other referral choices. And Debbie's going to discuss how being part of that critical care process or crisis care process is really going to give you that opportunity to help solve a problem that all discharge folks have, which is how do you provide care and how do you ensure that you're sending these folks to someone who's going to provide the care that they need. Tips for networking, maintaining relationships, and how to ensure consistent referrals. So, with all that said, Debbie, take it away.
Yes, I'll take it away. The power of the personal touch. So building relationships to increase referrals. And as Julio said, it really does take relationships. And building that trust with somebody takes time, right? And so what we're going to talk about is how to expedite that time from first meeting somebody to where you actually have a relationship where you've built that trust, which is really important in driving referrals. So by the way, I'm so excited to hear that there are so many people on the line, which says to me that people are very interested in this topic. And so I'm really hoping that we're going to be able to shed some light today. And I want to start with this. I'm going to start with this statement, which is based on my 18 years of being in home care, and then 17 years before that in big pharma. And what I see is that Americans are not willing to pay for prevention or preventative care. They pay for the crisis. All right. And when we look at senior care, it is very crisis driven. Now, it's hard to get stats to verify this as it relates to senior care specifically, but I've seen it a million times and you've probably seen it. I'm going to give you an example. I had a lady that I did an assessment with. It was a daughter from New York City who flew down to do this assessment. And this was a couple of years ago. I was actually doing the assessment. And mom and dad lived together. Dad had dementia. Mother was very hard of hearing and didn't sleep in the same room as dad, slept in a separate room. So the daughter was concerned because there were already signs of elopement. All right, so his dementia had advanced. He slept in the same different room, and daughter was afraid that dad was going to get out at night. Well, it's exactly what happened. All right, so what happened during the assessment is the wife said, "No, I'm fine. Dad's fine. We've got this." And they didn't go with the care. Daughter flew back to New York. 4 days later, I get a call. The dad left the house in the middle of the night to go let the cows out. He hasn't had cows in 30 years. Leaves the house, goes outside in the dark to let the cows out, which he did, in years gone by, and fell in a ditch, and he laid all night in the ditch. Neighbor found him. And so the next time I got the call, it was now 24 hours care along with hospice, and he lived 3 months. So now we're getting a huge number of hours, right? It was a crisis, and now they could no longer ignore it. So this is kind of what we see. And according to a report by Trust for America's Health, the U.S. spends almost $4 trillion annually on healthcare, but less than 3% of that is directed toward public health or prevention. So it's a mindset, right? It's even within our healthcare system. When you think about Medicaid programs, even long-term care insurance or veteran services, you have to really be incapacitated before they're going to pay for those services. No one's paying for preventative care, unfortunately. And so this is, when it comes to marketing, this is something that we really need to focus on, right? Because we want to be marketing at that point of crisis. So we want to, if we're not there, we're missing a huge opportunity. And you've heard me say this before, that we've got to have feet on the streets, building relationships with the people that engage with these people and their families at that point of need. So let's connect the dots here. This is basically how I keep moving the wrong button here. So typically what we see is the crisis, right? Which can no longer be ignored. And the sad thing is there were a lot of signs leading up to the crisis typically that were either ignored or swept under the carpet or denied, right? And so these are the things that we want to help our referral sources really understand, that it didn't have to get to them. But now that they're in a crisis, they need a solution. And that's where we want to be. All right. So you've got this situation, often involves the family to try to resolve and come up with the solution. Now they're going to be engaging at that point of need with a lot of folks, right? Might be the doctor, the care manager, the discharge planner. It might be the executive director or the wellness director at the assisted living facility, who wants mom to be able to come back to the community, but is going to require some one-on-one assistance at that, because that's a whole other level of crisis, where if mom can't go back to the community, what in the world is family going to do? Where is she going to go? So from a marketing perspective, we want to be engaging with these folks, these healthcare providers, right, that are at that point of need or crisis point, that are looking for solutions to offer those families in need. By the way, these are what we call our community-based referrals, right? Now, we really need to have somebody engaging with those folks to take advantage of those opportunities. And the reality is, 80% of home care revenue is generated from these referral sources. So if we're not out there pounding the pavement, building relationships with these people, we're missing out. We want to be the calm within the storm, bringing solutions that are ready to go for these folks when they need them. All right, now I've showed this slide before, and it just helps me really to drive the point here. When we look at community-based referrals, they really are the key to driving revenue and really to getting you to that next level, okay? Now, I wanted to show you a snapshot of within my own home care business, the difference between the lead generating or digital leads versus the community referrals that we're generating with our marketers out in the streets. And so I took a snapshot of June, it was June 23. And this is 1 month, and what you'll see in the green are the referrals that came from the community, and in the blue were the digital leads or lead provider companies like A Place for Mom or care.com, that kind of thing. So as you can see, the number of referrals that came in were 67 versus 49. So there were a lot of digital leads, but look at the conversion, right? The conversion rate, 71% of those referrals that are generated from those trusted professionals that we're calling on convert much higher. And by the way, they're much longer and bigger hours, okay, and longer retaining clients. So as you can see, of the 67, 42 clients actually started, all right, versus 9 that we started from those digital leads. So it just goes to show you how powerful those leads are, or those generating those referrals, building those relationships with people that are at that point of crisis and at that point of need. So if I was only relying on digital leads, I would have only signed 9 clients versus the 51 clients that we signed in that June. All right, and we see this time and time again. And sadly, Dylan, my partner for 52 Weeks, is on the line here. Sadly, we see still too much dependence on the digital leads, and people just can't get past that threshold and grow their business. And this is partly why that is the case. So community referrals is our superpower. It's certainly my superpower within my business. And the question is it yours? So we're going to look a little more deeper. And I want to start with this survey, if you can answer this survey. So where do most of your clients come from? Are they coming from digital leads and referral providers? Are they coming from community referrals like ours are? Or is it 50-50? And only tick 50-50 if you truly are 50-50. If it's 80% are coming from referral providers, then tick that one. So we want to know where most of your clients are coming from. So go ahead and fill that in, and we'll take a look at the results here in just a second.
I'm curious about the results of this one, Debbie, to see where people are getting these referrals from. I know that referral marketing and relationship building you've been talking about that from the very beginning. And I know you've said in different webinars, it's been the most successful way of growing your business, right?
For sure. And I mean, you have to do both. As you can see, we definitely are diligent about our digital leads because, there are some folks that will go to Google and do a search. They're going to do a Google search anyway, even if they get a referral from a healthcare provider. So you do have to have that presence and have a good website and all of that. But the key to really capitalizing on those digital leads and referral providers is getting that call, answering that call, or following up with that lead immediately. We've talked about that. You've got to have the infrastructure to jump on those leads, be the first call to get the assessment scheduled. So, and what we know is 40% of those types of referrals or 40% of those types of leads come in after hours. So if you don't have the infrastructure, you're missing a lot of those opportunities. So are we able to show the results?
Look at that.
Okay. So there we go.
That's interesting.
Yes. And what we've uncovered is that there are, in fact, the Home Care Pulse, I know it's not called Home Care Pulse anymore, but the the study that's done every year, the home care study that's done every year, only 50% of home care providers actually have a dedicated marketing person. So that's a problem. And sometimes they've had a bad situation and they're just like fed up with hiring a marketer. We work with a lot of folks, help them hire the right people. But it really is important as we look forward in when I start to show you some of the data, you'll see why it is so important. So yeah, we want to get those community referrals up and help you do that any way we can. Because at the end of the day, referrals come from relationships, right? And you can't build those relationships if you don't have feet on the street. So you've got to be at the table and having those conversations and having those frequent touch points that help us develop those relationships. And from those relationships, over time, you're able to start to really build partnerships. And with my organization and the amount of time that we've been at this, we've got some solid relationships now where we've been able to transition those relationships to partnerships. And that's where the beauty happens. And so it's, you really have to have a dedicated person knocking on the doors with solutions. So think about it as a solutions-based marketing system. All right. So let's ask another question here. So how many of you actually have a system for building relationships to increase those community referrals? Go ahead and tick your answer. I love being able to do these surveys.
It's great information, and I think it really helps us understand the value of what you're doing here, right? Because if like the last question, you only had 20% telling you that they use referrals, and you now have 80% that we can pull into doing referrals. You can significantly impact your business model and your growth by making that refocusing in different areas, which I think is really interesting.
Right. And this is going to help. I mean, our whole goal, and Julio and I really take this seriously, when we're doing an educational event, we really are trying to help you and educate you and steer you in the right direction. We've got years and years of experience doing this. And so, take advantage of what we've learned often the hard way. And we want to help you streamline things so that you don't have to go through all the ups and downs that we did. And, Julio's worked with lots and lots of home care providers across the country. You've seen it all, your own sales teams. And we love to share the concepts and methodologies that we've learned so that you get a faster on-ramp to success.
Yeah, I talk to agencies, dozens of agencies a week, and the most large successful agencies, a solid referral marketing program, whether it's 52 weeks marketing or something else, although we always recommend 52 weeks marketing. We think it's one of the best, if not the best program out there. The successful ones do relationships. That's just what they do. And it's amazing. And I will say, if I opened up an agency, I'd be calling you first before I did anything.
Thank you.
You're welcome.
I didn't mean for that to be a 52 weeks plug, but I'll take it.
Let's do it. We're here.
Yeah. All right, let's see the results. Where are we at? Okay, interesting. So 57% of people say they do have a system for building relationships. Okay, excellent. Well, maybe we've got some of our clients online as well that is definitely has a systemized approach here. So let's look at what it really takes. Okay, I'll take a closer look at solutions-based marketing, and it boils down to 4 key pillars. Is having a system that allows you to reach the right people, frequency, seeing them often enough that keeps the flow of referrals coming in, and the consistency, the consistent touch points, the follow through, the meetings, all of those things that you do that again builds trust. And through trust, we start to see those referrals, and for our referral partners to see us as true partners. And then finally, accountability, right? Holding ourselves accountable to the system, making sure that we are meeting those KPIs. So an anatomy of a winning marketing system, it includes a dedicated person, a database of referral sources or influence centers where we can be focused on those points of crisis or points of need. I'm going to talk about that in a minute. Having a routing system helps you stay consistent and hold yourself accountable. All right, so you're not willy-nilly all over your territory. You're being very, very focused, consistent, and efficient with your time. And then finally, solid messaging that focuses on solutions to those crisis situations that we're seeing. So again, just a recap of the methodology here, which is reach, frequency, consistency, and accountability. And that's really what we hang our hat on here with our system. All right, so I want to talk about two types of influence centers, right? And this is sort of a new concept that I'm going to be presenting here today. I haven't really talked about it in this frame, in this sort of situation, or as we've discussed influence centers. So, but when it comes down to crisis, right, dealing with those people in crisis and the people that we're calling on, two types of organizations. One is a crisis organization, which typically requires an admission process and a discharge process, okay? And so what's very, very important is timing. Timing is everything here. They got people coming in, they've got people going out. They're very focused on length of stay. These lengths of stays are getting shorter, so people are leaving sicker and quicker, right? So the timing for you to be calling on these people is really, really critical, and it needs to be frequent because they're having frequent discharges, okay? So calling on these folks on a weekly basis is going to be really important. Then you have your non-crisis organizations. These are folks that maybe aren't necessarily driven by admission and discharge, but you want to be frequently calling on them and staying top of mind because they have needs. All right, so consistency there is everything, and that we'll look at that in a little more detail. So when we think about reach, I'm going to talk a little bit more about that, where we want to focus, and focusing on those more urgent situations where we've got crisis organizations, okay? So some of us, sometimes people will say, well, I just hired a marketer and like, go get me leads. Well, we want to provide a real strategy for you. And the strategy is dominate at the point of need, like we've talked about. Where are those crises? Where are those people engaging with folks in a crisis? They're the hospitals, rehab centers, home health companies, hospice companies, skilled nursing facilities, long-term acute care. Those are the types of organizations that you want to be ensuring that you're seeing on a weekly basis, okay? Being at that point of need. Now, from the data, here's what I want to share with you. Crisis organizations produce 74% more referrals than non-crisis organizations do per month. All right, so when you are honing in on your route and who you're going to be targeting, this is really important. You want to, and this is what the data is showing us, okay? 74% of the referrals are coming from these crisis organizations. All right, now what are some of the crises? What are the triggers that we're seeing that land people in those crisis organizations? Big one is falls, medication mismanagement, mobility limitations where no one has done anything to help put some systems in place to make it safe for that person, poor chronic care management, cognitive decline. 70% of people at mid-level dementia actually still live at home until the crisis. I mean, that statistic blew my mind. And it will end in a crisis because people at that stage cannot continue to provide for themselves and be in a safe situation. Unsafe environment, right? So, especially with mobility limitations and you haven't got grab bars where you need, those kinds of things. Malnutrition, dehydration, those are probably, malnutrition's big one that lands folks in the hospital, especially with dementia. And then lack of support at home. All right, so these are the things, and unfortunately, the folks that are discharging these people, even though these patients are in their facility because of these reasons, very few people are saying to themselves, well, what are they going back to? If we haven't resolved these issues, they're going to end up back in the hospital, which is why we have such a high rate of readmission. And so you position yourself at that point of crisis. They need a solution And that's what you're there talking about. So of course, you are going to paint that patient profile. Look, social worker, you've got the patients that are transitioning home who are here because of a fall. We've got to address the fall or they're going to be back, right? So you want to paint that profile and then position yourself with the solution. All right, that they're seeing every single day. It's going to resonate with them, it's relevant to them. And this is how you're going to build relationships. These are the kinds of key messages that you want to be delivering. So, highlighting these key points, this is going to be music to their ears, right? How do you help? How do you differentiate? Fall prevention. So, what are some of those things? Medication management, mobility support, and all the things that you see on the slide. Chronic condition management. Okay. It's like 94% of seniors by the time they're 70 years old have at least one chronic condition, and 80% have two or more. So this is a big deal, and this costs Medicare a lot of money with hospitalizations, cognitive engagement, nutrition, hydration, and emotional support. So these are all things that we provide as solutions that we need to be talking about it and linking it to those crises those families are dealing with. Now, remember last week, we were talking about your unique value proposition. And so what are some of those things you can focus on based on crisis? All right, so it might be that you position yourself as providing a crisis care management program, all right, where you can have fast start care within 4 hours. Imagine that. That's gonna be very differentiating. You may have a readmission risk alert program. So I'm just kind of taking some of these concepts, the messaging, and how you can package that up as a unique value proposition. Chronic care management at home, hospital to home toolkit. So I kind of touched on those last week. I'm trying to thread this together here and get you thinking about how you can position yourself. All right, now let's look at frequencies. We talked about frequency is critical in terms of engaging with those referral sources so that you can build the trust. The faster you build the trust, that partnership's going to evolve, okay, and you're going to be generating referrals. So what are some of these activities in order to have those frequent touch points? What are you doing with these folks? Face-to-face engagement, scheduling meetings with them, offering presentations, doing some drop-offs if you're not able to see them, so at least they know you were there, and that's how you stay top of mind. So again, they're just more and more touch points, building trust. Hey, I'm the social worker may not have been at their desk, but I left them something so they know that I was there. Remember, timing's everything. That will trigger them. Oh, shoot, I've got Mrs. Jones discharging tomorrow. We need some fast turnaround time. They're going to think about me. So when we think about frequency and kind of scheduling how you're going to manage all of these influence centers across your territory, and I'm going to get into some numbers here in a minute, think about those top referral potential centers. Somebody that can give you 1 to 3 a month. You want to be seeing them weekly. All right, somebody that can give you 1 a month, and based on how many you actually have to cover, you may have to put some of those to biweekly, and then you want to see them quarterly. These are more of your long game potentials. Okay, so just to give you some of the ideas, and then we'll talk about how we can do this. All right, here's the fun part. This is some of the data that I wanted to share with you today. Okay, so we've had marketers across the country using 52 weeks CRM now for about 3 years. And it's definitely grown over the last year. And we now have enough data to guide us on what works and what isn't. And so I wanted to share this with you. But what the data does confirm is that on average, for a new marketer, okay, it takes almost 7 visits to generate 1 referral. If you're calling on them weekly, if you're calling on them bi-weekly, it's going to take almost 10 visits to get the first referral going. All right, so these are new marketers, and this is what it takes. So the more frequent you're seeing them, you're going to speed up that time to the first referral. Okay, you've heard that old adage that somebody needs to hear a message several times before it registers, right? This is like a sales and marketing adage, and it's true. So you want to shorten that time period the better the results are going to be. Now, I want to share with you what the successful marketers are doing across the country, okay? And what we refer to as successful marketers are those generating at least 30 referrals a month or greater. So it has to be a minimum of 30. Within that group, 67% of their activity is derived from face-to-face meetings. All right, which is why in our point system, in our CRM, we give more value to a face-to-face meeting because you get better results. The average number of face-to-face visits per referral is only 1.68. So less than 2 visits with a successful marketer, more seasoned marketer has been doing it this a minute and following the system, they get a referral like before their second visit. All right. Now, 22% of their activity is assigned to drop off. So again, they're keeping themselves top of mind when they're not able to see somebody. With our system, they've got some materials that they've always got something fresh to leave behind. But look at this. 11% of their activity derives from group presentations. All right. Now, this is really interesting. So of the group presentation, okay, when we look at the very high, so I'll share the results of the highest generating marketers activity. She dedicates 22% of her activity to group presentations. And when I say group presentations, I mean to 3 people for at least 15 minutes. All right, so this isn't like, somebody in the hallway or a networking event and you just happen to be saying hi to them. This is a specific presentation where you're going into issues, patient problems that you have solutions for. Something a lot more meaty. Were you going to say something, Julio?
Mm-mm. You're doing great.
Okay, so now when we look at the lower people are only doing less than 7%. Okay, less than 7%. So the highest, and as you can see, our highest is around. She's averaging about 42 referrals a month. That happens to be my marketer, one of my marketers.
So she's doing twice as many group activities.
Yes.
And so significantly increasing her results over the next closest marketer.
Exactly.
That's amazing.
Exactly.
It's a huge difference. For such a small number, it's only 22%, but it's generating a lot.
Exactly. So and I'm literally going to be sharing this with my team on Monday. They're going to be so excited. And so, you kind of assume that's why, that she's got a lot of successes, plus her face-to-face activity is through the roof. Now I'm going to share with you, this is so fascinating. I want to talk about the referral bell cows. Okay. So this is an analogy that I heard recently. And so I'm threading this in here. So, but on a farm, a bell cow is like on a dairy farm. The bell cow is the one that is always giving you milk. All right. There's never a dry moment. So it's always, that doesn't run dry. You can always count on this particular cow to give you lots of milk. So in our analogy here, our bell cow is a referral or an influence center that's giving you at least 1 referral a month. Okay. Now, the bell cows make up 62% of total referrals for our top performers. So we've got all their people that they call on, 62%. But of our top performers, 92% of their bell cows are crisis organizations. All right, so they're focusing on the right people that have the ability and are, because of that, those frequent touch points, they're getting the consistent referrals coming in. Now, what do you think is the most productive type of marketing activity? We've kind of already talked about it, right? It's the presentation. All right, so if you do a group presentation, you have an 84% chance of generating a referral within 30 days.
I can't think of a single marketing activity that I've ever heard of that has an 84% chance of generating success. That's a very high number. For those who don't know the marketing and sales business, that is an incredibly high number.
Yes. So, and we'll I'm excited about our next workshop, which I'll talk about here in just a minute. Okay. So again, it's at least to 3 people, and it's This is truly a presentation around a topic that's of relevance, that has patients that are in need. Okay, that's the key there. Okay, so now let's take a look at the least productive activity. Any idea what it is, Julio?
I am going to
We talked about
say, I'm going to say a telephone call. Oh, networking event. That's right.
networking event. Okay, it's if you attend a networking event, you have a point. So it's a 0.29% chance of generating a referral within 30 days.
And we know why that is. The clients are not at the networking events, right? Networking events are for working professionals, not the people that you want
Usually
to
other
speak.
marketers.
That's
They're
right.
not, I'll tell you, they're not the case managers and the discharge planners. You know where they are? They're at their centers doing their job.
They're working.
So pass on the networking, and where all your competition is at the networking event, you go make some calls on the discharge planners because nobody's there.
I love that. That's your number one time to visit is when there's a networking event locally.
Yes.
That's when you hit all the
Yes.
offices.
Okay, so get this. By the way, our top performers only spend 0.42% of their activity on networking events. So they're doing the right things, which is really, really cool. So now let me explain something to you. And this just happened to us this week or last week. So we, one of my marketers is calls on a huge independent living community, okay, huge high-rise apartment. And so she was talking to her about, she asked the question to the director, and she's very involved with the residents. They've got like a couple of people, like a wellness director. And so she had a meeting with them and she said, how often does an ambulance come to the building? You know what their answer was? Twice a day. Twice a day. So she says, this blows her mind. So she says, well, I'd really like to bring Debbie in to do a presentation because this is not a good situation. The falls are the big one. So she schedules me to do the presentation, and we call it "How to Stay Put and Skip the Nursing Home." That was the name of the topic, and they put posters all over the place. We had 45 people show up. They came in their wheelchairs. They come with their walkers. They come in, and the first thing I asked them was, "All right, so what was it that encouraged you to come?" Because I wanted to see if this message was resonating. They all said, "I don't want to go to the nursing." They'd all had the falls. So many have had falls. They've done the hospital rehab home repeat pattern that we see all the time. They don't want any more crisis. So we do the presentation that day. Okay. So we had a kind of like a calendar. We scheduled 18 assessments, which are being done tomorrow. And we've got a date next week of 2 case managers that are going to be on site doing assessments. And by the way, that was Thursday. Today's Wednesday. We've picked up another one almost every day since. Like family found out about it. They want to get an assessment done. So again, crisis focused, we have solutions. And so what we're hoping to do is we'll have enough folks that are ready and willing to get care in place that we'll have an on-site care manager. And so that's where we're going with that. So again, the value and the power of presentations. So lucky for everyone here, that's kind of going to be a topic that we'll be discussing in our next session. It's specialty programs that you can bring to actually present to these key folks that are engaging with people that are in crisis and that are needing some solutions. So stay tuned for that. We're going to have that coming your way. All right, so I'm going to ask this question, all right, and I'm going to I'll share some of the results. But what do you think, why do you think marketers fail to produce 30 referrals a month? So give this some thought. Is it because they're making less than 30 influence center visits a week? They're spending too much time on low producing activities? They work less than 4 hours a day in the field, or all of the above? All right, go ahead and answer that, everybody.
I know.
I'm sure you do. It takes a minute. I don't, yeah, there we go.
There we go. We got some folks coming. Come on, folks. We want to know we want your feedback. This is going to help us give you better information by giving us the feedback that we need. We're doing pretty good. 27% of attendees are answering. Let's go for 100%. I'd like to say I'd give a prize if everybody answers the question, but I don't actually have anything to give away today. Probably need to think about that on the next one.
A t-shirt or a hat or something.
I like the t-shirt idea. If my marketing team is on the call, sounds like we need care time t-shirts to give away on these calls.
Yeah. By the way, Julio, we've been talking about giving a prize to somebody that's attended all of our sessions. So maybe somebody could put that in the chat if they've attended all of our sessions.
I love that. Is anybody on this call that has attended every session? Let's see what's going on down here. All right.
Dylan might be able to give us the answer there.
We could probably track that down. Let's see the answer.
Yeah. Let's see what people think the answer is.
We got to 71%. Thank you.
All right, very good. So most people said all of the above, and it is all of the above. All right, so we talked about it's important to have that base that you're calling on consistently, not spending too much time on those activities that aren't really worth your time. But here's one that I haven't touched on yet. A lot of people spend less than full time in the field. And you as owners have folks that aren't working a full day. We see it through our CRM. And that's one of the things that Sean is really working on with our users and coaching them on how to manage their marketer. If somebody's in the field working part-time, that's not fair to you. You're paying them a full-time wage, right? And so you want to get as much productivity out of them as possible. So that's something to be considering and something that you need to focus on. And it's something that we're actually able to capture through the CRM and be able to coach our marketers that are using the system. So keep that in mind. All right, so it is definitely all of the above. All right, so let's look at how to kind of stay organized, how to stay consistency through your route scheduling, okay? And this enables you to it's sort of like, there's a term called implied stability. I love this. And what it basically says is that you build trust by building this implied stability. Frequency helps you do that. And this is from a study that was done in Frontiers in Psychology, which says it takes a minimum of 4 consistent visits to establish trust, which we've kind of seen in our results, right? So what I love about the route is it helps you to stay on track so that you don't miss anybody and that you are seeing them consistently. Now, how many people should you see? Your goal should be 30 influence centers a week. And we have top performers that are consistently doing this and consistently getting 30 referrals. It's kind of easy math, 30-30. If you're calling consistently on a weekly basis 30 influence centers, you will achieve 30 referrals. And if your conversion rate's around 80%, you're looking at somewhere between 20 and 25 new clients a month. That's substantial, right? That's a substantial business and a way to really grow. So, and then of course, within those 30 influence centers, you want to see as many people as possible that are engaging and interfacing with seniors at that point of need, at their crisis, and their families, and be developing relationships. Our marketers will go to a rehab center and probably see 10 people within that building. And it's a good lengthy visit, but everybody in the building knows who we are, and we're able to really get the referrals out of that facility. All right, another thing when it comes to discharge planning, and this is a little gold mine, okay? When it comes to routing and setting up your route, put your appointments for your referral centers so that you're touching base with them after the discharge meeting, as soon after the discharge meeting as possible. So if you find out, say, for example, a home health organization has their case conference on Tuesdays, you want to be calling them or touching base with them Tuesday afternoon or Wednesday, all right? So that's really important. So attend any care planning meetings if you can wiggle your way in there we've developed some great partnerships where we're actually on site doing that with those teams, attending case conferences for home health hospice. Be there before they discharge so that you can help them. All right, so let me give you an example. All right, so say the plan of care meeting at a rehab center is on Wednesday. All right, but you've got them on your schedule to visit them on Tuesday. And Bob's fly by the night home care shows up on Thursday. Who do you think is going to get the referral? All right, who do you think is going to get them at that crisis organization? It's going to be Bob's fly by the night just because of timing. Remember when I said earlier, timing's everything when you're calling on these folks. So build Thursday visit into your route so that you don't miss out on that opportunity. And then they begin again, that trust thing, right? They begin to trust that you're there to support them, solve their problems. Okay, so differentiating yourself, delivering value. What separates you? And you have to answer this question. What separates you from the other 10 agency? And by the way, oh my gosh, they're popping up everywhere. The competition is just getting fiercer and fiercer. I'm telling you, I don't know what's going on.
I'll share it from my point of view, Debbie.
Yes.
We sign 50 startup agencies a month. All over the country, granted, not in Nashville. Yes. We're keeping them out of Nashville away from you. We're going to keep you. We're doing the best we can. No, but in general, and I'm just one company out of many. And so if you think about that, that's hundreds of agencies launching every month nationwide. Yes.
Yeah, my marketers are complaining about it. We've got all of our clients across the country, same thing. So differentiating yourself with real solutions that address those folks in crisis, right? Bringing those outcomes to those organizations that are being measured on those outcomes. And then being consistent that builds trust, that gets you to that partnership position quicker. And so, one of the things that we do to support our clients is by providing educational materials that focus on crisis points and solutions that you all have through your services. So again, just kind of trying to tie that all together. Now, this might be a lot. You might be thinking, how am I going to do this? This is like very complicated. It's not that complicated. We have a system that breaks it down for you. It's the 52-week system. We have an incredible CRM that helps you manage your marketer. And we now have virtual assistants that keep you focused on marketing, help you with your operations on the back end of things. So if you need some more information, Dylan's QR code is there, and we are here to help you. All right. So I think this might be our last couple of survey questions, and then you can wrap up.
Perfect. You got it. So folks, if you want to learn more about the 52 Weeks Market System that helps you with your turnkey marketing, route scheduling, and building relationships and drive those referrals that Debbie's talking about, just click yes. We'll make sure we get your information over to the right folks. I've been working with Dylan and Debbie for a very long time now, and I can promise you that they will give you an honest and true assessment, and they will tell you and help you with what you need. And bottom line, I do know their system works. If it works, if you work it. So please go ahead and answer the questions if you're interested.
It works if you work. You know what we often say?
It works if you work it.
It's not easy. It isn't easy, but if you work the system, you can't fail.
It's not easy being green, is it? So we will. Let's move on to the next slide. If you're interested in learning more about care time, when you're growing a business, it's really important that your general operational efficiency is there so that you can focus on the marketing. Working with somebody like Care Time who understands the agency business, we can increase your efficiency, help you get paid faster, and help you retain your caregivers, which is going to give you a better business that you can use to go run and use these marketing efforts out there. We are experienced in both Medicaid and private paid nationwide, wherever you guys are. So if you'd like to learn more about how we can help and get an inside track to Debbie, you can give us a call. I know I've shamelessly used that, Debbie. Please go ahead and answer yes for us if you're interested. We'd love to get to know you a little bit better. And again, we will give you an honest assessment of whether or not we can help your business. And if we can't, we'll tell you. And if we can, we will. Otherwise, we really appreciate the time you guys gave us. Very excited about you jumping on. Don't forget that we're going to be here again on August 20th at 12 p.m. learning about how to do specialty programs such as dementia, which is my biggest fear, just to share that with a bunch of random strangers, is my biggest fear is dementia. So knowing that there's people out there that can provide care for folks like that is vitally important. Otherwise, Debbie, thank you again. This was great.
Good to be with you all. Did we get an answer about who we've got that's been with us all of our sessions?
I have not seen anyone answer here. Let's see if anybody claimed knowledge here.
Claimed our prize.
Let's see. Mitzi says it's her first time. Thank you, Mitzi, for joining. Kit says it's her first time. She loves it. Dylan's back there welcoming all the new folks, Debbie. He's got it covered.
Great.
Perfect.
Good to have you all.
Thank you, Debbie. It's good to see you again. Dylan, I know you're back there in behind the curtain making things happen. And also I'd like to thank my marketing team, Casey and Rachel, for helping us put this together.
Yes. Bye, y'all.
Have a great day. Bye-bye.